time, it was in 2003 when we had a first SARS virus breakout, and that was in China. And the second one happened in Middle East, and that was the MERS virus, and that was in 2013 time. Both of these viruses had propensity to kind of attack human lung, and they caused significant pneumonias. That was, the major problem to deal with, and that's why it's called SARS, or which is sudden acute respiratory syndrome. That is, acutely you get a respiratory illness from these viruses. And with coronavirus also, that's what we have seen, that this virus has a predilection for causing damage to the lungs. The good news is, now that we have been in this pandemic for the last 3 months, we know what this virus does. We know how to counteract it. So we are able to catch it early, treat the patient early, and send them home. As far as developing a medication goes, unfortunately, we have had so many antiviral medications and so many viruses that we are dealing with. There has never been a medication that has been a cure to a virus. And for example, if you have the common flu, you take Tamiflu. The Tamiflu, the doctor will tell you, take the medication. With this medication, your illness is not going to be as severe, and where the illness was going to last approximately 7 to 10 days, your illness will last 3 to 5 days. Same thing with dealing with coronavirus. The medication remdesivir, which has just come out, is a good drug. And again, it helps us deal with the virus easier than if we didn't have that medicine. As you all know, and the media has kept up with it, there are many vaccinations that are being tested right now. And hopefully by September, October, we will have some vaccine with good immunogenicity at our, for our common population to use and help with the virus. Any questions so far?
I had a general question. What do you think about local businesses reopening and going to a restaurant or a bar at the moment?
So I think the question here is, how is this virus transmitted? Now the virus is transmitted, our major source of infection is through our nose, our eyes, and our mouth. Now, and if we look at it, how are we going to get anything into our eyes? If somebody sneezes at us, somebody coughs at us, the particles can go up to 6 feet. That's why the social distancing of 6 feet. As far as mouth goes, most of the time, it is because we are touching a surface where maybe somebody had just sneezed, maybe somebody had just coughed, and the particles are on that surface, and unknowingly, we touch our mouth with our hands after touching that surface, so we have infected ourselves. So wearing a mask is not about, protecting others. It is about protecting yourself. If you have a mask on, the likelihood of you infecting yourself by touching, and unknowingly touching the virus and touching your mouth is very less. Also, if there is somebody who has the infection and they are unaware of it, and they are coughing and so forth, now that putting on a mask prevents that spread. So coming to restaurants and businesses, I think we still need to continue wearing the masks to protect ourselves and as a common courtesy to other people. Washing hands is the key. So whenever you go to a restaurant, they are doing their best to clean the surfaces, and they have their protocols from the Illinois Department of Public Health that all their servers have to keep their masks on and so forth. But your duty, your job should be wash your hands before you eat, or, clean your hands before you eat. So opening up is actually good, and I'll get into that. But I think at this point, it is be responsible. We cannot stay closed up like this. Um, so be responsible, wash your hands, protect yourself, keep your mask on when you're outside, keep the social distancing going, and that's how we will be able to, collectively prevent further spread of this virus.
So I have a question. This information that I'm going to share, I might read some of it. It was in a text message from a friend of mine whose husband is a pediatric oncologist at the University of North Carolina in Raleigh-Durham. And she says that some big research came out in Cell, a journal, a peer-reviewed journal, that found that COVID can really latch in the nose cells better than the upper respiratory tract. But she goes on to say that, according to this research in this Cell journal, that it isn't actually a respiratory virus, but infects the endothelial cells, which make blood vessels. Hence why it has all these devastating effects on unusual parts of the body that respiratory viruses don't typically impact.
Okay.
So she says those cells are weakest if you have heart disease, high blood pressure, diabetes, and those are the most affected populations all overall. Anyway, I thought that was very interesting.
Right. So coming to the point is, now that we have had to deal with this virus for the past 3 months, we know how this virus works. So just to kind of give you an example, if, any infection, any virus, bacteria, fungus, anything, it's a foreign, organism to our body. There is always a port of entry. For example, if a person has a urinary tract infection, the port of entry is your urethra, right? If you have a pneumonia, the port of entry is your nose or your mouth, and somehow that bacteria got into the lungs. So the nose, the eyes, the mouth is the port of entry for this virus. However, just like, for example, there are, it'll be, let's see. Okay, everybody understands hepatitis, correct? Hepatitis A virus, hepatitis B virus, hepatitis C virus. These are all viruses, but they get into your blood like hepatitis A. It goes, you have to eat it. You have to eat a contaminated meal or something to get the hepatitis A virus. However, it goes to the liver, and that's where it causes the problem. Hepatitis B and C viruses, they are more, you have to kind of have direct connection with the blood somehow. It has to directly enter into your vessels or bloodstream, or somehow for you to get infection with it. But it ends up in the liver. So same thing with this virus. As we are learning more about it, this virus it starts as a flu-like symptoms. Basically, some people have fevers. Some people develop nausea, vomiting. Some people even developed diarrhea. Some people develop severe headaches. And then initially person feels a little better in next 24, 48 hours. But then at about day number 6, 7, 8 is when they start becoming really short of breath, or their condition starts deteriorating. And what we realized is that during that time period, I don't know if you have heard in the media, like happy hypoxia, which is basically these people are short of oxygen, but they feel like they're doing okay, they are comfortable, until the majority of their lung is now compromised and they cannot provide oxygen to their bodies. So during that time, from autopsy results of unfortunate patients, we realized that what is happening is that the small vessels in their lungs, they are getting damaged and getting clotted. So actually, there is no exchange of oxygen happening at the very small alveolar level. Alveoli, as you know, are the small bags, air bags, but they have, you know, vessels around them, and those vessels bring blood that is filled with carbon dioxide, and then you know, as we inhale, there is oxygen. Is there, you know, oxygen is diffused across the membrane into that blood, and that blood is taken back to our heart for pumping so that we can, the rest of the body can be supplied with oxygen. So with this virus, it is targeting those small vessels and causing clotting. It is not that it is causing directly clotting, but it is initiating an inflammation in the body. You know, and that inflammation is what is resulting in clotting. And then over time, now we have seen patients who come in with blood clots in their lungs. We have seen patients who have had strokes. We have seen patients who have had, you know, like blood clots in their limbs and so forth. But this happens, like I said, about a week into the illness. So anybody who gets diagnosed, we tell them, if first 5-6 days are when you're, you know, you're going to be okay, but day number 5-6 is when you really need to monitor. If you start feeling short of breath, if you start having cough, if you start noticing that something's not right, you need to come to the hospital immediately. The other thing some doctors are now doing, since we know what to do, is moment you're being tested, you're being given small dose of some steroids, some blood thinners, so that this process can be mitigated before it even starts. And that has helped too. However, there is no standardization yet. The only thing that has come out so far is that the blood thinners have really helped. And recommendation is that if a person goes into that cytokine storm or that inflammation, then they're started on blood thinners, and those blood thinners should be continued for 4 to 6 weeks until, you know, they're cleared from any issues related to clotting. Did that help? Marianne, did that help?
Oh, somewhat, yes, somewhat.
Okay.
It's just a lot of information for me to process.
So, I mean, to understand it, like I said, the good thing is we are 3 months into it. So we know what the virus does. And in a simple terms, it causes 2 things, or actually one major thing, which is basically sends your body into this inflammation mode. And as the body goes into inflammation mode, the body produces chemicals. Those chemicals don't understand good or bad. And when, you know, the process has already started, we can try to mitigate it, but we cannot completely halt it. For example, if you hit your hand on some surface, the first day, it just hurts a little, but you see the whole swelling within next 24, 48 hours. Does that make sense?
Mm-hmm.
And that's how this virus works. It starts this process of inflammation, and that inflammation, the effects of that inflammation we see in few days. And that's, over time, we have realized that it's actually damaging the small vessels and major clotting effects happening, and the lungs are becoming essentially non-functional, and the body is not getting the oxygen it's supposed to get.
Okay, it looks like we have a comment from Betty. She says, I wear a mask when I'm out walking on a bike path and notice many people not wearing one and not social distancing. Maybe I should change my routine and walk earlier in the day.
So Betty, as far as if you're not in direct face-to-face with them, you are fine. The people who choose to be, most of the people who are kind of not socially distancing are with the people that they have been for a while. Otherwise, I think people should show some responsibility, and we should kind of if you don't know the person, socially distance. Wear a mask. If you have been with, for example, your family member, your children, your loved ones, you have seen them off and on, those people are fine. But as long as you're not directly in their face and they're not coughing at you, and you're not, if you're wearing a mask and they are having a communication at a regular tone and level, they're not yelling at you, your 3 to 4 feet difference is fine.
Okay, another comment from Annie. How does it affect people that are already on blood thinners? Is that why they're considered high risk?
So actually, no. We are kind of looking into data right now that, as you know, and the news has kind of spread it out there, nursing patients. And, the patients who were actually on thinners did okay. They did not get as severe of a disease because they were already on blood thinners. But I cannot say this for sure. I cannot prove any data for you guys, but I think those kind of comments hopefully can be proven as we move forward. But there is some indication that people who were on blood thinners who got the virus actually did okay, especially did okay. Even some people who were on aspirin, just taking aspirin daily, also we felt like they did better than people who were not. But I'm not saying start taking aspirin. I'm just making a comment.
Doctor, I have a question about herd immunity with this virus. Will that come only when we have a vaccine? I'm unclear about that.
Okay, so let's go back a little bit. So if you remember, let's just take chickenpox or smallpox. And in like ancient ages, when Chinese people started this, they would actually take the, from the blister, they would take a little bit of a fluid and put it in the kid's nose to infect them. And the kid would get the disease and they would not get the actual chicken pox. Then in India, they started using needles. They would puncture the vesicle and take the scraping and, put with the needle, just make small punctures in their skin and inoculate their skin with that virus. So what is herd immunity? So herd immunity is basically, if you remember in old ages when somebody had chicken pox, your mother would say, oh my God, somebody has chicken pox, please go play with them. The idea is that you get exposed to the virus and you get the infection and your body's internal system develops the immunity or the antibodies against that virus, and you're immune to it for the rest of your life. Chickenpox is the best example that we have seen so far. So as far as herd immunity coming to coronavirus, so initially when as you can see that now that more and more data is coming out, it is becoming more clear that there are way more many people infected than we know. But those people are not coming to the hospital, they're not sick. So we have to assume that those people have developed some immunity to it. Mm-hmm. As we are opening, there is no 100% way to protect you, me, or anybody. But the dose of the virus is very important. So for example, if I get exposed to say 3 or 4 viruses just to trigger my immune system, to start producing the antibodies, is better than me getting millions of viruses at the same time that they overwhelm my system and my system is not able to fight it. So as we move along, as there is more mobility in the community, I think more and more people are going to get exposed to the virus. And we are seeing that. as we are testing more people, people are turning positive. The number of infected people is going higher. However, we have not really seen as many admissions to the hospitals, and that's what's driving the opening of the communities, the businesses, and everything. And that's what is herd immunity. So when 70 to 80% of your population is exposed, that's when the community is considered immune to that disease.
Okay.
However, it is, so right now I don't know the actual data, but before the lockdown, it appeared we had exposed about 14% in major cities like New York, California. So there was about 14% of the population that was exposed. Now, as we are slowly opening up, I think we will expose another 20-30% of the population. And when they go to the last phase, then we will expose another 20-30% of the population. So hopefully by August or so, we may reach that point where we have 70 to 80% of the population exposed, and we can start talking about maybe as a country, as a community, as we have some herd immunity.
Okay.
However, right now the dilemma is the antibodies. You know, how do we know if 70% of the population is exposed and they have the immunity? The only way we can find that out is by checking for antibodies. Now, which part of the virus is most immunogenic and which part of the virus is our body targeting? We don't know that. And that's the work in progress right now as far as antibody testing goes. So FDA has not said that which test is the best antibody test available. We have quite a few available, as you know. People are paying out of pocket to get it done, but none of them has given us a very reliable answer. We have had patients who said that, oh, my antibody test was positive, but then now I'm infected, or like false positives. And then there are patients who have had the disease and they have gone for antibody testing and their test is negative. So we don't have standardization yet, and I'm hoping next month or so we should have a standardized antibody test, and hopefully by that time more and more people will be exposed and we can have a true answer whether we are heading towards herd immunity or not, which will be the perfect scenario.
Thank you.
One comment from Terry. She says, so if I have isolated myself completely using curbside groceries, etc., I may be hurting myself by not getting a little exposure to the virus?
There is no way to say whether you are, it is like this: protect yourself, but you can't keep yourself locked up. At some point, you have to go out and live. Because today it's coronavirus, tomorrow it may be something else. However, be smart about it. Wash your hands, wash your hands, wash your hands. I can't say enough about that, and then keep your mask on. You know, be careful. If you have a family member who's been coughing or who's been ill, be straightforward. Say, you know what, you have a little cough here. Let's just kind of let you get over with it before we start, having some parties or getting together or something. Can you be protected 100% at home? No, because I have had patients who have done exactly the same as you have and still come into the hospital with the infection. Now, how that happened, I can't tell. I mean, their kids were dropping off the groceries, they didn't go out, they didn't do anything, and we have still had some infections, maybe through some, I don't know, it's hard to say. So I would say, yes, live a little, but be careful, and yes, go out. Locking yourself down is really not going to serve any purpose.
Does anyone else have any questions or comments? Okay. Betty says, is it necessary to still be disinfecting grocery items?
I would not recommend disinfecting grocery items. Again, if there is a packet, you're opening the packet, you're touching the food, um, you know, but the toxins, and who knows what is in the disinfectant, and you may be consuming that. It's not a good idea.
So if we go to the grocery store and you get produce, you would just recommend washing it, rinsing it off in the sink, and that's good to go?
Do as you usually do. Yes, rinse off everything, dry it up, and don't eat anything raw that's not washed properly.
Okay. Betty says she's still disinfecting packaging. Do you recommend that?
Again, it depends on where how comfortable with you are. As far as it's just the container you're disinfecting, that's fine. But produce, I would not.
And I personally, I read that the coronavirus will like dramatically change your body. I'm assuming this is only if you've had a severe case where maybe you'd had to be put on a ventilator. But I read that it could make your blood thicker and it will give you lasting lung problems.
So think of it as the injury. Injuries can be with a knife, with a stick. You may fall, and you may, or any other way you can have an injury to the skin. So what you're experiencing inside in the lungs is an injury, is a trauma to the vessels. So when a vessel is blocked off, like if this is my finger and I, block the circulation to the tip of my finger is going to turn blue. And over time, it can become permanently damaged, right? So these small vessels that are being clotted by this virus, those small alveoli that are responsible to help us oxygenate our body are dying. And as they're dying, they're becoming scarred. Now, how much of that will regenerate itself, or how much of that will come back, only time will tell. But yes, and people who have had severe illnesses because of this are requiring quite a bit of time to recover based on how much of their lung has been damaged. And it all depends case to case. And then we don't know the long-term effects. Only time will tell as to, like I said, how many of the how many of the alveoli will re-recruit them, and our body will be able to preserve them.
Okay. I also wanted to ask, my audio is a little warped. I'm not sure. Is anyone else hearing that? Can you raise your hand if it's a little warped? Yes? Okay. It might be your microphone, Dr. Dhillon.
Okay. What do you want me to do? My microphone.
Maybe turn it off and then turn it on. Or you could exit the meeting and then re-enter if you would like as well.
Is it better now?
No.
I had a question about wearing gloves. I wondered if you saw it. Should we still be wearing gloves, like when we go out or go to the grocery store, or in general?
So wearing gloves is kind of, so what I have personally seen with people who wear gloves is they wear the gloves when they leave the house, right? And they're touching different surfaces. They touch their car, their steering wheel, then they go into the grocery store, they touch different surfaces, and then they walk out with the same gloves to their car. And they don't take it off until they go home. So they have actually contaminated quite a bit of surfaces as they are moving around with the same gloves on. The gloves should be a single purpose. For example, If you want to wear your gloves when you are in the grocery store, then put them on when you're right walking into the grocery store, and take them off once you are done putting your groceries in or whatever, because you don't want to take those germs or anything from one place to the other to the other. Washing your hands before you enter into your house is the best protection you have. At home, the same thing. Wear the gloves if you are, say, for example, somebody who wants to disinfect their packaging before they want to open it. Yes, wear the gloves when you're disinfecting, but then throw those gloves away right away. It should be single purpose. So, and when we work, we keep our gloves to one person or one procedure that we are doing, or so we don't take, so most people think that the moment they wear their gloves as they're leaving their home, their hands are protected. No, you're just touching different surfaces and taking germs from one place to the other. Does that help?
Yes, yes, it does. It makes more sense to just wash your hands frequently.
That's correct. And most of the grocery stores and everybody has, hand sanitizers and stuff for you to before you leave or when you come in, because they don't want you to bring their germs to them either. So they have those sanitizers and everything. I would encourage using them. Use them as you're leaving, and before you get into your house and start touching anything, wash your hands and then go by your business.
I have a question. Also, if anyone has more questions, feel free to speak up or type them in the chat. Do we know if someone can get the virus 2 times?
There has been no research or no indication so far of reinfection. However, how long the virus stays in your nose, we don't know. Secondly, we have seen that the repeat testing done at about 4 weeks, 6 weeks, some patients is still coming back positive. Now, mind you, these are PCR testing. In other words, we're looking for the viral RNA. It's like, like in those murder mysteries, we can check for DNA when patients or somebody's been dead like several years ago. Same thing here. We're looking for that nucleic acid. And who knows it's live or dead? The patient's fine, but then we check the RNA, it's positive. So there's a lot of confusion about that, but there has been no indication that if a person has recovered, they are getting it again. No, there has been no indication of such. And that's promising, and that's what we are basing our quest for vaccine and so forth, because you can't make a vaccine for anything that may be mutating or infecting you again and again. That means your body is incapable of producing any antibodies. So no matter what you do to the person, no matter what vaccine you give to the person, it's not going to work. It's like polio. Polio is a virus. You take polio vaccine when you're a kid, because it's a one virus, and you have the immunity for the rest of your body. The rest of your life. Does that help?
Yes, it helps. Okay, I have another question. Unless, Marianne, do you have a question?
No, I didn't. Thank you.
Okay. Are we still on the first wave of the virus, and what does that mean? / will there be a second wave looking at China right now?
Okay. So, again, I'm not an expert in epidemiology, no way. However, from the clinical standpoint, what I have seen, I have not seen a second wave. What I have seen is increasing number of testing and finding out that there are way more people infected. And as we are moving forward, we will see that more, because people will be exposed and people will test positive. I have not seen a second wave. I mean, biggest example you have is Georgia, state of Georgia. They opened the first, and nobody has seen any second wave or anything. They are moving along perfectly fine. And so is Florida. Yes, you will see increased number of cases, yeah, because we like I said, now even they are mandating testing. You know, for anybody who's positive, they want to test them again and again to see when the virus is going to be out of the system. But those are just kind of more for knowledge purposes. So personally, I don't see that happening, but again, I'm no expert in that, and I can't. It may in the fall when the weather changes, and because that's when most of the coronaviruses come back. That's when most of the people get the colds, the sniffles, is it possible that this virus at that time can cause problems? Absolutely, but we are hoping that with the way things are going, we may have a vaccine by September, October, for people who need it at least.
Okay. Oh, Belinda says, once they find a vaccine, wouldn't they have to conduct extensive trials on humans to see if there may be adverse reactions on certain people?
Actually, the trials are already underway. They started about a month or so ago or more. They have already started injecting humans because that's what they need. They need to know once they inject the component. So to make you understand how the vaccines work. So a virus is a particle. It has a envelope or a kind of a, everybody's seen the pictures of the virus, right? It's like a ball with spikes, the red spikes coming out. And then on the inside of the virus is like a one single stranded RNA. So there are components of the virus. There are the proteins, the red spikes that come out. There's a wall of the cell wall or the envelope of the virus. And then there is the inside of the virus, which is the RNA. So what these vaccines, what the basis of the vaccination is that you can't, they don't want to inject the live virus into the human body because that can cause a very severe reaction and nobody knows what will happen. So they take the components, they take the protein, they take the envelope, they take the RNA, and sometimes they actually, inactivate the virus so that, all you're doing is giving the whole virus, but which is not a live virus, or it is live but attenuated. It does not carry the infection or the infectious component. So once that component of the virus or the inactivated virus is injected, then they have to see the body's response. So all these people who are currently receiving the vaccination under the trials are being evaluated to see what part of the virus creates the most immunity, or what part of the virus activates the human immune system to develop immunity. And then they will pick up that either the particle or, for example, I mean, everybody get tetanus toxoid, right? So we're not actually injecting you with the tetanus spore. You're getting the poison that the tetanus spore produces, and you're giving a little bit of it injection, but your body produces the immunity against that poison, and then you're not bound to get tetanus again. Does that make sense?
Mm-hmm.
So same thing with this virus. We don't know yet what will be the best option to get your immune system working, and or which component will create the most immunity. So once they find that out, then they'll be able to kind of produce a vaccine at kind of a mass production.
Okay, I have another question / comment. I know someone who believes that they got the virus. They were not tested because they didn't have serious enough symptoms to be tested. And they think they had it, they got over it, and now they can go around in public and they will maintain the 6 feet, but it's not really an issue of them getting anything or spreading anything.
So theoretically, they're fine. They are right in their thought process, but unless and until we can guarantee either by an antibody testing that you've had the test before, there is no way for us to tell them that you're safe to do what you're doing. So they may think that, but there's no way for us to prove it or disapprove it.
I think that if a person knows they had it or thinks they had it, it would be beneficial for the general population for them.
Oh, Marianne, it looks like you.
I'm sorry, my granddaughter is calling me, so that interrupts it. So if a person gets an antibody test, that either proves or disproves whether they had it. Is that correct?
That is correct. But we don't have a standardized or a good antibody test to get a real answer. You may get an answer that may be wrong. That's the problem right now with the antibody testing.
My son-in-law was tested 4 times. The first 2 times he tested positive, the 3rd time negative, a 4th time positive, and then he had an antibody test which confirmed that he had the virus.
Okay, then you can put 2 and 2 together, like, yes. But then if a person who has never been tested positive and gets an antibody test, right now we don't know whether they're truly immune or not. FDA, actually, if you remember, about a month or so ago, there were a lot of talk about antibody testing. And suddenly, a lot of companies came out with a lot of different tests. So FDA had to issue a statement that antibody testing is not standardized about 2.5-3 weeks ago, so that to stop that. Because
what does it? I'm sorry, doctor. What does it take to standardize an antibody test?
First of all, we need to figure out what element. So for example, hepatitis B virus. Okay, when we test somebody for an antibody to see that they are immune, we test for hepatitis B surface antibody. Okay, so the envelope is what is the most immunogenic. If you have hepatitis B surface antibody, then we know that you have been immunized or you are immune to it. Okay, but if that is negative, then we know that you are not immune to hepatitis B and you can get it. Now there is hepatitis C virus. Hepatitis C virus can infect you, but our body is incapable of producing antibodies to it. So once you get hepatitis C virus, you're infected for your life. You have to take chemotherapy, treatment protocols to kind of keep it under check, but your body inherently does not produce any antibodies to fight it off. So that's what the dilemma is, that this virus right now needs, a little bit, we just need a little bit more time to come out and say, okay, it's the red proteins that are on top of the virus which produce the antibodies. So that's what we are going to look for. Or it's the RNA itself that produces the antibodies. So we're going to look for that antibody. So that's what we're waiting for right now. So there are a lot of antibody tests available right now, but we don't know which one is in a general population, which will give us the best answer.
I see. Very interesting. Thank you.
Okay. We are 8 minutes before we wrap up. We're going to end this around 7:30. So does anyone have any last questions or comments that you would like to type out for Dr. Dhillon or speak into your microphone? Okay. So in the fall, it should get worse. And are we expecting that the coronavirus will mutate if we look at the past histories of SARS outbreaks and similar viruses?
Actually, the past SARS viruses have not gone beyond 3 to 6 months. So let's hope that's how this one does, but we don't know. This one has spread way more than the others. There were sporadic cases of the Chinese SARS virus and then the Middle Eastern respiratory virus here and there, but nothing like this virus. This virus has spread across the world. So that's another thing which people should keep in mind, that if a virus is spreading so fast, then the protection we are using is really, no matter what we do, it's gonna affect us. Like we can't just live in a bubble and not, if wherever the air is, it's going. So I mean, again, I'm no expert. Time will tell, but I think at the broader level, the CDC people and those people, they know that, and I think that's why there is a push for this vaccination. Whether it's going to behave like flu virus, which mutates every year, we don't know that. But if that's the case, then we will be looking at a vaccine every year, just like we are looking at, we get the flu vaccine, we're going to get a coronavirus vaccine every year. If it doesn't mutate, and most of the population is exposed, and antibody testing can help us to see if we have herd immunity, then I think that would be the best scenario, where only people who need the vaccine are given the vaccine, and other people are told that's great. But we also, then the question becomes, how long does the immunity will last? So do we need to revaccinate every year, every 2 years, or what? So those are unknowns right now. But the good news, like I said, is we know what to do. God forbid somebody does get infected. We know how to monitor and how to manage and prevent severe illness or long-term complications. So we are actually treating patients and getting them home within a couple of days if they end up in the hospital. Very few patients are heading towards the severe illness, and most of them who do head towards that way somehow, I as reported from New York, and we are seeing the same thing. It's just the delay in them taking an action to getting home or getting help, because they feel okay. They're like, oh, I'm okay, I don't need to go to the hospital. And before they know it, they crash. And by the time they come to us, the inflammation, the damage is a little bit far, and then it takes us longer for us to kind of get them back.
Where are you located?
Right now, my office, I have 2 offices. One is in Silver Cross Hospital, and the other one is in Lombard.
Oh, okay, thank you.
Dr. Dhillon used to have an office in Palos Heights, I believe.
Yeah,
correct?
we're going to restart that in a few months.
Okay, one comment from Betty. My gym might be reopening in July and taking extra precautions, but I'm not sure if I want to return. What are your thoughts on this?
Same thing. Again, if you're in a gym, they are going to be very cautious as far as people who are running. So your running is your treadmills are probably going to be blocked up, or you may be asked to, you can only use one at 6 feet different or something, because people are huffing and puffing and forcing air out, which spreads the germs further. I'm pretty sure they will have their protocols as far as equipment goes, but my recommendation is, and I think before even coronavirus, people were becoming more cautious about wiping the surfaces and so forth. And I think that's where you would be, again, it all comes down to touching the equipment after exercising, wipe it before you touch it, wipe it after you are done to help other patrons, and then wash your hands. You wash your hands before you leave the gym so that you don't take anything with you. But
Okay.
I mean, as far as going to the gym, I would say you should. It's good to exercise.
One comment from Terry. Do you recommend we buy a pulse oximeter?
It may not be a bad idea, actually. God forbid if somebody does get infected, and that's how, because of this happy hypoxia or the initial feeling of well-being after getting infected on day number 2 or 3, the only thing that may guide you is if your pulse ox is dropping. And if you check it and say, oh, it was 9 on room air, as long as on room air you're over 91, 92, you're fine. But once it drops closer to 90 or lower, that means you're heading into trouble and you need to go to the hospital. And if they tell you go home, you tell them, no, call my doctor. I'm not going home.
Follow-up question from Terry. What is a good brand of pulse oximeter?
That I don't know. Anything is fine.
And for clarification, the pulse oximeter is?
It's a small little device which looks like a small stapler, I would say. And then you just kind of put it on your finger, and it kind of gives you a percentage of oxygenation, how oxygen in your blood, and it just is an infrared light system, and it sees how how bright your blood is and so forth, and correlates it with oxygen. As long as I said you're above 90% on room air with that pulse oximeter, you're fine. If you feel like it's kind of dropping, then you have to seek help.
And another question from Terry. What is the best type of thermometer?
Well, the reason, any thermometer, if you can use the oral thermometer, as long as you're the only person using it and cleaning it. The reason to use other thermometers is because now, touching, like how do you, when you're using it on 100 people every day, you don't want to touch the thermometer, anybody's skin or anything of the sort. So that's why they're using those infrared thermometers.
Okay, well, it's 7:30, so thank you guys so much for coming, and thank you, Dr. Dhillon, for presenting and explaining this in very great layman's terms for us all. I know we've been getting a lot of thank you messages in the chat.
Well, it was a pleasure, and you guys can reach me anytime. And hopefully all of us stay healthy and reach that herd immunity and never have to worry about it again.
Yes, thank you for your time, doctor, and your information.
You're so welcome. You're so welcome. Have a great evening, everyone.